Hi everyone, I am Dr. Madhuri Manvatkar. I am practicing at Chandrapur, Maharashtra since 2001 as a general surgeon. But really, who am I? A general surgeon, laparoscopy surgeon, ENT surgeon, physician or a gynecologist? People don't know my degree, but they believe me. To know this, we have to go back to my childhood. I was born in a small village whose population was not more than 5,000 at that time at Shegaon, Tehsil Varora, district Chandrapur. I was the sixth child of my parents. I was quite bright in studies according to my father who was a school teacher. I have done my 10th in same village and went for 11th and 12th to Taluka place, got admission at GMC Nagpur, but some of my family members were not ready to send me to study MBBS. They told my father that what to do by teaching the girl, we have to spend money on her education and again for her marriage. But my father said, if my daughter has the capacity, then I will teach her. I took admission at JMC Nagpur in 1986 and passed in 1991. Then I did MSc ENT from the same institute. While doing MSc ENT, I did 6 months house job in medicine. That time we could do 6 months housemanship in other subjects. Meanwhile, got married in 1995 and passed MSc ENT in same year. Then I joined at General Hospital, Gadchiroli as a medical officer and worked there for 1 year. At that time, there was a new rule that for PG admission, 1 year rural service was mandatory. So my husband suggested me to do a second PG in gynecology. Because in rural area like Gadchiroli or Chandrapur, people know a female doctor as a lady specialist. Though I was practicing as ENT surgeon at Gadchiroli, people were asking me to see lady patients. So I applied for next PG. OBG by post was not there, so applied for general surgery. I took admission at IGMC Nagpur. I was pregnant that time, so I was unable to join and requested the HOD for extension for 1 year. It was my second complicated and very precious pregnancy. My obstetric history was not good. I had IUD of full term of first pregnancy and second was after induction of ovulation, complications of ovarian hyperstimulation, huge ascites and pleural effusion. In that I had a twin pregnancy. One of the twins aborted at 12 weeks and second survived. So I had complete bed rest. I was admitted at GMC Nagpur for 4 months. After discharge, within 15 days, I had premature rupture of membrane and delivered a 28 weeks premature preterm baby who was admitted in ICU for 1.5 months. When my baby became 6 months old, I joined for general surgery in 1998. There were all my juniors. They were testing me and giving me some tasks to test me whether I was really done my post-graduation or not. But I was doing it very sincerely. When I joined for this course, I was posted at female ward. There were so many small children in surgical ward. When they used to cry, I feel very kind and my dress got wet by milk secretions. I used to keep pieces of sanitary napkins under my bra. No one will consider any female problems. We have to find the way by our own. My husband is very supportive. My husband and in-laws took care of my premature baby. I used to go home once or twice a week as I was staying at hostel. I passed my MS General Surgery in 2001 and joined as medical officer at Civil Hospital Chandrapur. There I had to work as a common doctor and not a surgeon. After 1 month, they gave me the charge of surgeon at female ward, and after 6 months I was shifted to male ward. Daily I was performing 8 to 10 surgeries and 5 to 6 emergencies alternate day. So many complicated cases I handled there without a facility of even the cautery at that time. In spite of those, I had to perform 5 to 6 caesarean sections daily and hysterectomies in routine OT. Meanwhile, I took MTP training of 6 months from the same hospital, so performing MTPs up to 20 weeks after getting the certificate of the same. To learn about normal delivery, I used to spend time in labor ward and getting tips from the sisters. Sometimes I was posted there in absence of gynecologist. We took a small room for private practice and started practicing there. But a surgeon not doing any surgery, he cannot survive. I was restless. I was doing small sebaceous, dermoids and very small surgeries there. We used to autoclave the drum at home and performing surgeries in clinic. I learned to make surgical pads, gauze pieces, sponges, bandages by the hospital sisters, because you should know each and everything about setting up of the hospital, as we were not getting the qualified staff. Then we took a small floor on rent and started practicing there in 2002. It was very difficult for me to see male patients at my place. Male patients were reluctant to show me. I used to keep my husband beside me for examination of male patients, but they have faith on me. Nowadays, they are coming by their own and preferring me for their operations. I was not happy because I wanted to do some different. At Chandrapur, surgeons were doing urology practice. I also wanted to do some specialization in urology. Then I asked my teacher, Dr. Raj Gajbhie. He advised me to do laparoscopy training. And the next week, that means me and my husband, went to Coimbatore for laparoscopy trainings. Every time my husband, Dr. Prakash Manvatkar, who is anesthetist, was accompanying me. I used to learn laparoscopy and he was observing as well as taking keen interest in management of anesthesia. Because laparoscopy was new to both of us. After the training of 7 days, I started doing laparoscopy at my place. We used to wake up at 3 o'clock in early morning. I was watching the videos on video player of laparoscopy surgery which were provided by Dr. V. Venkatesh. My husband doing preparation of OT. Then I was going to OT and helping my anesthetist husband for anesthesia. After anesthesia and stabilizing the patient, he used to help me like a circulating nurse. One attendant used to hold the camera. That's it. After finishing the surgery, we were taking care of our daughter and sending her for school. And then we were going for our job at government hospital. It was difficult to do at our own place because at that time people were not ready to get laparoscopically operated. They admitted in our hospital, but after some time they were going to other hospital for open surgery. Then I decided not to tell the procedure of operation to the patient. We started live telecast of surgery to the patient's relative who were waiting outside. Then they were convinced. Initially, other surgeons called me and asked me not to do this type of technique. But I continued my work on my own style. I was the first one who started laparoscopy surgery at my city as well as in our district in 2003. So I was getting a name and fame there at Chandrapur. In my first case, I was not successful to insert the varus needle. The patient was quite obese. I converted to open and did the surgery. I was disappointed and cried whole night. I was worried that I had purchased a set of laparoscope of stores on a loan. How can I repay the loan? That was my main concern. Next case was laparoscopic tubectomy. That also I could not perform and converted. Then I did ovarian cyst and slowly I could overcome. Initially it took about 2 to 3 hours for a small surgery. Now I can do it within 15 to 20 minutes. To improve me, We attended so many basic and advanced laparoscopy trainings, so many workshops and conferences, did so many courses of laparoscopy. Every time I was accompanied by my husband, he was attending the whole session with me. Meanwhile, I took the fellowship of IAGS, MAS, ISCP, took training of endoscopy, now performing upper and lower GI endoscopy, fellowship of hernia surgery from GEM Hospital. In 2007, we shifted to our own building. It was 30-bedded hospital. Then expansion of hospital to 100-bedded in 2014. We have 22-bedded ICU with all facilities like CT scan, 8-bedded dialysis unit and everything except MRI. When my guide, Dr. Methi, came for the inauguration of my hospital and appreciated me, he told his friend at Nagpur that he went for a 100-bedded hospital's inauguration at this place and the owner is a female surgeon. His friend's word was like this: 100-bedded hospital and that of a female surgeon is not possible. Even a male surgeon cannot set up a 100-bedded hospital. Those were the encouraging words for us female surgeons. Now the family responsibilities are quite over. My daughter has done BA English Literature and Creative Writing from Birmingham University, UK, done international law there, now doing job at the same place. Now we are running a BSc Nursing College with all hospital responsibilities. Our hospital is NABH accredited. Every time we get Cleanest Hospital Award from our local municipal corporation. Soon our GNM Nursing College and Pharmacy College will also start from the next session. When I took admission for ENT, boys were teasing girls saying, सर्जरी लड़कियों का काम नहीं, जाओ गायनी वायनी ले लो. बट हमने दिखा दिया है कि लड़कियां भी कुछ कम नहीं. As my physical height is less, so many ergonomic problems were encountered. Initially, OT tables had quite standard heights. I used to stand on a wooden platform while laparoscopy surgery. Now my OT table is tailor-made. I have 4 modular OTs. I am performing most of the laparoscopy surgeries here. From appendix to hernia, all gynecological work, DU perforation, trauma cases, hemoperitoneum. Recently I did splenectomy of a trauma case. With this, I am doing all general surgery work. I don't have to call a ENT surgeon for tracheostomy in my ICU. I learned central venous catheterization from my husband. Most of the part of anesthesia I can manage. I can intubate any difficult case. When my husband is out of station and other anesthetists have difficulty in intubation, I do it without difficulty. I can do lumbar puncture. I can do skin grafting as good as plastic surgery. Last week, I was performing a trauma case, exploratory laparotomy. Patient had complete transection of the stomach. While completing the surgery and after peritoneal wash, I kept clean mops surrounding the incision. Our plastic surgeon entered my OT and saw this. He said me, after his PG days, he saw this type of systematic surgery. My cesarean section patients saying that madam is performing cesarean section by laser. No scar or very fine scar is seen. Our guide was saying us that surgery is not only the book says, it is our skill, our experiences and what our brain and heart tell us while surgery. It is a great example of decision making. There is a phrase, behind every successful man there is a woman. To this I want to correct, behind a successful female surgeon there is an anesthetist husband. If we do a surgery and if not successful, then the anesthetist leaks this news to other surgeon and other male surgeon got a chance to finger out of us. In spite of medical work, I am interested in music. I learned Sangeet for 6 years when my daughter was in 9th class. She pushed me to continue my hobby. I am writing some blogs when I feel something. In Diwali, like to draw rangoli. I am very good in cooking, especially in non-veg and puran poli, which is a Maharashtrian dish. I can make very thin puran poli just like our simple roti and that too very soft. Preparing bhakri, that is jawar roti, is giving me so much fun and makes me happy. I like to prepare different dishes and to feed others. I learned to ride a bicycle at the age of 15. Got awarded as professional icon of Vidarbha by Lokpat paper, Sakal and Metro IDN. Now I can think I am a successful surgeon and proud to be a female surgeon.